कर दी. Bismillahirrahmanirrahim. You can see the screen, right?
Right, sir. Yeah.
Okay. So Jahan, the point where we stopped last time, so I was touching base with the complications of alcoholism, which included Wernicke's encephalopathy, Korsakoff syndrome, and delirium tremens. Delirium tremens is the most commonly asked question in exams, especially in MCQs. It's again a very simple thing, but still people should know about it. It is a complication of alcoholism, occurs in 5% of alcohol withdrawal. So delirium tremens never comes when the person is taking alcohol. It occurs when persons discontinue taking alcohol. It's one of the withdrawal symptoms. Onset is usually 48 to 96 hours after the cessation. So when people stop drinking, first 24 hours, nothing happens. And then after 48 hours, they start experiencing these symptoms. Duration is usually 1 to 5 days. Even if you don't do anything, patients passes through certain phases and they are okay, but if they are physically and otherwise healthy. There are reports that there is significant confusion, disorientation, severe anxiety, fear, paranoia, agitation, restlessness, insomnia, and prolonged periods of sleep and hallucinations. Now, most of these symptoms occur 48 hours after the discontinuation of alcohol. So जब भी withdrawal symptoms की हम बात करते हैं, they are exactly opposite to the effect of the drug that you are taking. So alcohol causes reduction in anxiety, reduction in fear, reduction in paranoia, agitation. It calms down. It makes you feel sleepy. And exactly opposite happens here, except for the increased periods of sleepiness. The rest of the things are part of it. Hallucinations, primarily in delirium tremens, the primary hallucinations are visual in nature. They see insects, rats, tiny people. Tiny people is called micropsia, pink elephants, tactile hallucination in the form of crawling sensations, formication. Auditory hallucinations are usually persecutory in nature. Usually they are not very well defined, but they feel that people are against me and they are trying to plot against me and things are difficult. And autonomic symptoms like tachycardia, hypertension, fever, sweating, but they are not usually very common. ये बाद में पढ़ेंगे. Okay. Initial control of delirium tremens continue until patient is awake and calm. Previously, there was intravenous phenobarbital available in the market, which was given as the dose of 10 milligrams per kilogram body weight. It's very difficult to get phenobarbital injections now. So usually this is not the treatment in Pakistan, but usually phenobarbital, which is an anticonvulsant and a sedative, is given in delirium tremens, 10 milligrams per kilogram body weight. IV diazepam is the second option, but usually this is the first option in majority of the situations in Pakistan. The dose is 10 milligrams and gradually it needs to be escalated up to a dose where patient settles down. So 10 milligrams, 20, 30, 40, 60, and then we can keep pushing it up. Usually for diazepam, intramuscular injection is not recommended because it gives unpredictable pharmacokinetics. Usually diazepam should always preferably be given intravenously, and you give 10 milligrams, then 20, then 30, then 40, keep escalating till the time the patient is sedated, slow, calm, and comfortable. And after a while, in 3 to 4 days time, you'd gradually withdraw diazepam and patient gets well. So this is the ideal treatment for delirium tremens. Initially, when people start taking alcohol, and they leave it. There are a few other terminologies which are used in alcohol withdrawal. One is the shakes, so they develop jerks like this. Then the second thing is alcohol withdrawal hallucinosis. They feel that insects are crawling on their body, formication, which I have talked earlier. Then there are alcohol withdrawal seizures. That is the most difficult complication. It difficult in a sense that if person starts developing seizure, it could be life-threatening, and then person develops delirium tremens. So the confusion and seizures usually are complicated situations, but delirium tremens is manageable with diazepam. All of them, they are treated with the same pattern, which I have discussed earlier. Usually when we try to treat alcoholism, the assessment comes first. And assessment includes vocational services, mental health services, medical services, educational services, HIV, AIDS, and other services, legal services, and family services. All of these are combined together. So if we miss any one of them, so if he's having symptoms which are related to the physical health, then we have to go for medical services. Then educational services, we have to educate the family, educate the patient. This is about to happen. Will be happening in times to come. And this much time is required for you to recover completely and out of this problem. And if he is having other signs and symptoms of HIV, AIDS, hepatitis, or other infections, then of course we have to treat this. Hepatitis usually is related to the involvement of the liver. It's not hepatitis C or other infections. It's related to the alcohol and liver. Legal services, people do have some problems associated with chronic intake of alcohol, property disputes, family disputes, and other. So we need that services. And family services means lots of reassurance, education, and there again something to support the families so that this is a curable, treatable, amendable problem and things will be okay, but these things do need time. Medications, as far as alcoholism is concerned, there are 4 different kind of medications that are given to the people. Most commonly an effective medication is acamprosate. पाकिस्तान में acamprosate की availability कुछ जगहों पे है. It comes in a capsule form, which is a 333 milligrams or 666 milligrams. And we usually try to push up the dose from 330 milligrams once, twice, thrice, then 666 milligrams capsules 3 times a day, which patient has to take for a longer period of time, maybe for 6 months to a year, so that he won't have the cravings for the alcohol again. This is the best possible medication for alcoholism, but if it's not available and accessibility is not there, then you can use disulfiram, which is a 500 milligram tablet and you can give once or twice. The problem with the disulfiram is that it is hepatotoxic itself as well. If people are having alcoholism and their liver is involved, then disulfiram is probably not a good choice. Then the third option is naltrexone. Although naltrexone is given to people with opioids, but if the people are having alcoholism, it can be tried. It reduces the craving. It's a 50 milligram tablet which can be given once a day for 6 months to a year time. Sometimes we have to combine acamprosate and naltrexone together to get the desired response if one of them is failing. So this is the ideal pharmacological intervention. Furthermore, disulfiram and naltrexone, if again, just like in Pakistan, naltrexone sometimes is available, sometimes it is not available. Acamprosate and disulfiram, same situation. Sometimes they are available in the market, sometimes they are not. Then we have to rely on some other drugs, like ondansetron, 5-HT3 antagonist. This is a centrally acting anti-emetic, which can be used at the dose of 50 to 100 milligrams per day. We can use olanzapine, quetiapine, or topiramate, but they are not the treatment of choices. They are just treatment which can help, but they are not the ideal treatment for alcoholism. But topiramate, valproate, ondansetron, nalmefene, baclofen, entalarmin, and rimonabant. And these are basically the drugs which are acting on opioid receptors, antihistamine, GABA, and glutamate receptors. So they are mostly given in that sense. Primarily, pharmacological intervention includes ideally acamprosate or a combination of acamprosate and naltrexone or disulfiram. But if all the threes are not available, you can try any one of them. But trying one drug, sometimes it's not enough. So usually what I try to do is to give ondansetron and combination of baclofen plus an anticonvulsant. If I have no other option than these three combining together. So one will act on histamine 3 receptors, the other will act on GABA B receptors, and the third one will be acting on GABA receptors and probably sedative purposes as well. हम मोहब्बत में दरख्तों की तरह हैं नासिर, जहां लग जाएं वहीं उम्रों खड़े मिलते हैं. Alcoholism is difficult to treat. So overall, the treatment of alcoholism includes one, thiamine, which we discussed last time, sedative hypnotics, which I talked today, diazepam or phenobarbital. Then drugs to treat dependence are disulfiram, naltrexone, and acamprosate. And if needed, then we can go for other treatment options. Well, this is what it is. I haven't covered alcoholism in a way that the psychological management of alcoholism. And the reason why I never covered it was that I thought that we should try to cover only the pharmacological methodology. But if you people will be interested, the psychological management of alcoholism is again something which should be covered as a whole subject. It's not something very small. It involves multiple psychotherapies that we have to utilize in alcoholism, right? So far, this is what it is. Any questions? Anybody? No? Quick question, abhi alcoholism se related, before we start the next topic, Cytochrome P450. It's a small topic as well. It won't take much of your time. So let's start this if no question. Cytochrome P450 enzyme system. Now, this is tricky. If you recall the biochemistry, which I have difficulty in recalling because I was not very good student of biochemistry. I don't know, somehow or the other, I never liked the subject. Ratta bahut tha aur concepts kam the. This is what I felt. But people say, no, it's a lot of conceptual knowledge. So I don't know. There are enzyme system in liver or in across the body as well, which actually take care of the compounds which are entering into the system. So like if you want to break down glucose into an active thing, you have to break down it. Water को break down करें तो hydrogen और oxygen बनती है. Sodium chloride को break down करें तो वो sodium अलग होता है, chloride अलग होता है. और chloride की अलग utility है body में, sodium की अलग है. Both of them, they are not actually, they remain as sodium chloride. They are broken down into sodium and chloride, and they are utilized at various places in the body. Same happens here, that when a drug, any drug, is given to a person. It goes through a system in the liver, and this enzyme system is called Cytochrome P450, which is related mostly to psychotropics. And the drugs are broken down into simple compounds through the process of reduction and oxidation. Reduction, oxygenation, hydrogenation, these are the three processes which makes the compound simpler, activate them, and then make them available for their effect in various nervous system places like receptors, presynaptic, postsynaptic, or synaptic level. So any drug which we take, when it is made, it is not made in the form of a compound which is probably readily available in the body. Probably lithium is the only thing which goes straight into the blood system and straight into the system and have an effect. The rest of the drugs, they have to be broken down into the active ingredient which goes up to the synapses and the receptor level and have an impact. And to do that, Cytochrome P450 is the enzyme system. So our liver has these enzyme systems, and it actually transforms the drugs into metabolites, and the metabolites goes into the systemic circulation and have an impact. Whenever we have any dietary intake, xenobiotic substances actually starts taking place. In the liver, cytochrome P enzyme system, most commonly for psychotropics, is 2D6 and 3A4. Two of them are important. There are other types as well, which breaks down the drugs through, again, multiple metabolic processes, as I mentioned earlier: oxidation, reduction, hydrogenation, and fatty acid metabolism. You don't have to remember all of them, but again, I'm trying to simplify this to make you people understand. So Cytochrome P450, or the enzyme system, basically converts the inactive metabolites to active metabolite, which goes into the systemic circulation to have side effect, therapeutic effect, or some undesirable effects as well. So it is actually the active metabolite which is used as therapeutic effect. And any drug, when it is made, it is made in years, not in days, except for messenger RNA vaccine, which was launched very quickly. But messenger RNA drugs were actually under the experimentation process for at least more than 2 decades, and the breakthrough was not there. With COVID, messenger RNA vaccines were made. They were tried in humans, and billions of people data was available to the pharmaceutical company that messenger RNA drugs are actually working drugs. Messenger RNA drugs are now used to treat cancer, infections, and multiple pathologies in the body. They were in experiment for 2 decades, but now they are available. All of these drugs are broken down through the cytochrome P450 enzyme system. Now, just to name some of them, like Lipitor, which is a statin, is then broken down by enzyme system 3A45. Most of these psychotropics are broken down by the enzyme system cytochrome P450, 2D6, 2C9, 2B6, 2C19, 3A4, and 5. But considering all of these are difficult names, and I don't think so that we have to remember all of these names. But just briefly, the polymorphism, induction, inflammation. Now, there is a research, some people in Pakistan, they believe in that research. I don't believe in it, that because the enough data is not available to make me convinced. People say that the Pakistani population needs less amount of the drug because their enzyme system is not so active. So low doses of the medications can help the people. I haven't seen that in my clinical practice, and I don't believe that as well, because I was not able to find any data where I can say that if the escitalopram dosage is 20 milligrams per day, in Pakistani population, 10 milligram will work. In majority of the situation, it won't work back to the remission phase. So you have to give a therapeutic doses. But there is a concept, and it is related to this cytochrome enzyme system. 20 to 30 million subjects have cytochrome P2D6 enzymes, which too slow drug metabolism, too high drug levels at ordinary dosage, no response from certain prodrugs, and high risk for adverse effects. This is unfortunately the problem with the enzyme system. You cannot predict unless or until you have a precise test about the enzyme system of that individual, which comes through the genetic testing. So if you have a genetic testing available, which we don't have even for intellectual disability people in Pakistan, if you have a genetic testing available, they can test the enzyme system and tell you that your enzyme system is this, and this drug will have an impact on this much dosage, so you don't have to go beyond that dose. This is a complication which is more related to psychiatry. Now, brain cytochrome P450, it has multiple dimensions. So it can have, it's basically in your genes, and it is related to age. So older people have less enzyme system, so you have to reduce the dosage. Children have less enzyme system because it's not developed properly, so you have to reduce the dosage. And in the general adult population, you have to use the therapeutic doses. It varies from ethnicity, but the data is not too strong. Some people say that the data is strong. Well, they have variations. Maybe they are right. I don't know, but I have different viewpoint. So any drug or any diet, the drug can be broken down and it can go into the system and have an effect on cancer, epilepsy, psychiatric diseases, neurological diseases, and all that stuff. Three things are very important when we are talking about the enzyme system. One is substrate, second is inhibitor, and third is inducer. And this is what you have to learn. Substrate. So some drugs like benzodiazepines, they are the substrates, and they usually don't have an impact directly. So they are metabolized, they go into the system, and they stay like that and have a therapeutic effect, and they are excreted out from the system. Now, some drugs are inhibitors, like calcium channel blockers, like in psychiatry, valproic acid or divalproics or epival. They are inhibitors. What they do is they increases the level of any other drug given with them to have more of that drug into the system. So they inhibit the enzyme system, so the other drugs passes into the bloodstream. More higher levels are there and they have more side effects. Inducers like carbamazepine, they reduces the metabolism, so the drugs are less available in the system and they have less impact. This is actually tricky, and how it all goes, that's tricky as well. Now, cytochrome P450 is a superfamily of monooxygenases, enzyme system called monooxygenases. They are heme-containing enzymes or hemoproteins, officially abbreviated as CYP, is a large, diverse group of enzymes that catalyze the oxidation of organic substances. They absorb light at a wavelength of 450 nanometers. The substrates of cytochrome P enzyme system include lipids and steroid hormones. So they go into the system and they have direct impact. Xenobiotics such as drugs and toxic chemicals are usually substrate as well. That's the reason why poisons are dangerously in the system. So चूहे हमारे गोलियां बहुत ज़्यादा affect करती हैं. Cytochromes are the major enzymes involved in drug metabolism and 75% of the total different metabolic reactions. Present throughout the body. So they are across the body, but major concentration is in the liver. Act primarily in the ER of the hepatocytes and the cells of the intestines. Conditions that cause viral hepatitis or cirrhosis will affect the efficiency of drug metabolism by CP enzymes. Human CPs are primarily membrane-associated proteins located either in the inner part of the mitochondria or in endoplasmic reticulum cells. Some are metabolized one way or the other, while others may metabolize multiple substrates. Humans have 57 genes and more than 59 pseudogenes divided among 18 families of Cytochrome P450 genes and 44 subfamilies. To simplify this enzyme system is actually having 18 different families. Each family has 57 predecessors genetic combinations, 59 further children, and 44 children of their children. So it's basically a complex mechanism. When somebody asks how many Cytochrome P450 enzyme system are in the system, so you can say hundreds and hundreds of them. 57 multiplied by 59 multiplied by 44 multiplied by 18, that is the complexity of this enzyme system. You can imagine it's a huge number. But generally, we say that they are approximately in 50s, but they have subfamilies, they have genetic combinations, and they have different other families. So they are a huge number in the system. Many drugs may increase or decrease the activity of various CP and isoenzyme, inducing the biosynthesis of an isoenzyme, enzyme induction, or enzyme inhibition. This is a major source of adverse drug reaction. If one drug inhibits CP, cytochrome P450 or enzyme system, then it will lead to the second drug level into a toxic levels. So we have to be careful. And this is a very common problem with the psychotropics. We are very fond of combining the medication. So we give risperidone and escitalopram. They do interact with each other. We give a combination of olanzapine with tricyclic antidepressant, which unfortunately is a lethal combination. So if we talk about these small combinations, which are usually seen in the prescriptions, people don't have the knowledge that these drugs may interact with this one. Ideally speaking, we should have a detailed knowledge about each of these drugs, which can cause the other problems. This is unfortunate, but this is true. So increased rate of metabolism, decrease in drug plasma concentration, enhanced oral first pass metabolism, reduced bioavailability, reactive increased drug effects or toxicity are all common problems. Cytochrome P450 2D6 is extensively studied enzyme. The gene for cytochrome P450 2D6 is highly polymorphic. So when people start taking alcohol, which I was just teaching just few minutes ago, over the period of time, person do get used to it the same amount of alcohol. This is actually one of the things which is related to the polymorphism of enzyme system. We have to understand that as well. Drugs like carbamazepine, they do have polymorphic enzyme degradation over a longer period of time. So once you are giving 600 milligrams of carbamazepine and patient was seizure free, he may develop a seizure again in 2 years' time because of this polymorphic mechanism. So it's nothing to do with any other thing. So don't get confused. Okay, 2 साल से तो fit free था, और इसी डोज के ऊपर तो अब फिट क्यों पड़ गया. So of course we have to understand the other dynamics as well, but one of the contributing factor is this one as well, polymorphism. So remember, there are in psychiatry some drugs which have polymorphic qualities because of the enzyme system. So substrates, inhibitors, and inducers. What are they? Substrate, an agent that is metabolized by an enzyme into a metabolic end product and eventually excreted. Inhibitor, an agent which interferes with the ability of given enzyme to metabolize a given substrate. Competitive, allosteric. Inducer, an agent which causes an increase in the production of the enzyme responsible for metabolizing a given substrate. So, common agents associated with the hepatic enzyme induction: carbamazepine, modafinil, oxcarbamazepine, phenobarbital, phenytoin, steroids, of course. They are all drugs, and in schizophrenia, people tend to smoke a lot. It's because it reduces the levels of the antipsychotic drugs in the body, and it relieves the adverse side effect. So smoking, nicotine, is associated with metabolism of antipsychotic medication into our system. You have to remember this as well. Managing hepatic enzyme induction, 5 principle. Prescription or non-prescription agents may induce hepatic enzyme. Inducing agents can lower plasma levels. Most psychotropics are metabolized by the liver. Hepatic enzyme induction can result in subtherapeutic plasma levels. Assume that any inducing agent may lower plasma levels and alter the efficacy. This is important. So for you people, if you really feel that you need to understand the drug interactions, there are tables available in basically various pharmacology books where it is mentioned that this drug is enzyme inducer, substrate, or anything else. So you can go through that. But this topic is important just to be sure that you should know what actually it is. So there was one hand raised. Go ahead. Who is that?
सर मेरे एक दो क्वेश्चंस हैं। एक
Yes.
तो ये कि आप कार्बामेज़ेपिन का बता रहे थे, उसकी जेनेटिक पॉलीमॉर्फिज्म का, तो एक तो ये कि वो चीज़ दोबारा एक्सप्लेन कर दें, आई डिडंट गेट इट। और दूसरी बात ये कि अभी आप जो कह रहे हैं कि हमें वो टेबल्स गो थ्रू करने चाहिए, वो हमें किस बुक से प्रेफरेबली देखना चाहिए, जहाँ पे इतना प्रिसाइज़ हो, जो हमारी नॉलेज के लिए इनफ हो? तो उसके लिए
Okay.
कोई जगह भी बताएँ जहाँ से हमें वो देखना।
So second question का आंसर पहले दे दूं। देखो, जनरली स्पीकिंग आपको जरूरत नहीं है कि आप ये सारी चीजें जबानी रट्टा लगाएं। मैंने कभी नहीं लगाया। यूजुअली एक बेसिक कॉन्सेप्ट आपको पता है, जहां पे आप कॉम्बिनेशन ऑफ ड्रग्स इस्तेमाल करते हैं। एक पेशेंट को आप ईस्टेलोप्राम देते हैं और लो डोज में आप उसको एरिपिप्राजोल दे देते हैं, जस्ट टू एड्रेस अदर सिम्टम्स और व्हाटएवर। उन जगहों पे आपको रेफरेंस देखना चाहिए। Easiest way, which I do, I just type the drug on the Google internet search and type the drug name, interaction with this drug. And usually it's available, readily available. Once you will be able to have an idea that this drug should not be given with this drug, you'll be good to go. After some time, you'll be able to memorize all of them. So you don't have to go through all of them because it's a long list. When I was making this presentation, I was looking at it, there were at least 126 drugs in psychiatry which have interactions with the other drugs. And we usually don't care about them. We give, one day I was writing a prescription here, I wrote a prescription here of citalopram and converting it into escitalopram. And the pharmacist immediately sent me a big fax with the again interactions. So I knew that, but I had to cross titrate. So I just had to tell them that, okay, fine, I am aware of this, but go ahead with the process because I know that one drug will be off and the other drug will be taking over. So things are okay. But when you don't know the interaction, then you write a, हमारे यहाँ psychiatry में बहुत common है polypharmacy. जब हम polypharmacy करते हैं तो हमें नहीं पता होता वो कौन सी दवाई किस चीज के साथ लड़ गई. और फिर पेशेंट आगे कंप्लेंट करता है कोई भी, like he complains that I am having abdominal discomfort, and you won't be able to understand what's happening. You will say probably he's developing some stomatitis or gastritis or something like that. But actually, it's the drug interaction which is causing these problems. So ideally, when you are giving combination, which we usually ask not to, then you should be careful about these interactions. Otherwise, in psychiatry, don't panic. Like carbamazepine and valproate are the most commonly used drugs, and they are used in combination because we give valproate and carbamazepine with antipsychotic medications, antidepressant medications to enhance the effect, and blah, blah, blah. So we know, most of us, and benzodiazepine, but other combinations, you have to be careful. Combining an antipsychotic with an antidepressant, combining an antidepressant with anticonvulsant, combining an anticonvulsant with antipsychotic and a benzodiazepine. You should know the interactions. Polymorphism. Polymorphism means changing the shape, multiple shapes. Morphism, body morphism. ठीक है, आपकी basic क्या बोलते हैं उसको उर्दू में, hayat, something like that. It's basically your figure, your outline. Polymorphism means when something can change its shape from one to another. In enzyme system, this is unfortunately, because I told you, these enzyme systems are actually genetic based. So our genes are carrying a coding system to induce an enzyme system in the specific time period in our life, which starts around 3 years of age. And after that, these enzyme systems keep on developing and changing their shapes according to the situation. So Pakistan में रहने वाले मिर्च मसाले तेज खाते हैं, वेस्ट में रहने वाले मिर्च मसाला हल्का खाते हैं. क्यों? क्या इनके टेस्ट बड खराब हैं? उन पाकिस्तानियों के टेस्ट बड बहुत अच्छे हैं, या उनके टेस्ट बड खराब हैं, इनके टेस्ट बड्स अच्छे हैं? Actually, this is polymorphism. So when you are used to it, right from the day one, we are fond of cooking the food in ghee, and unless or until the ghee is on top of the salan, it's not tasty. So our liver adapts to that. Our genes modify the metabolism, and then it goes throughout our life. But people who don't eat that much oil, they have less of the metabolism polymorphism as compared to people are having more lipids. This is what the polymorphism is. When you keep on giving a drug like antidepressants, like fluoxetine, 60 milligrams per day for years and years, there will be some change, polymorphism in the enzyme system of the liver. So that is one thing. Well, for fluoxetine, I haven't heard this, but definitely for carbamazepine, valproate, clozapine, some of the other drugs, I'm not able to recall all of them, they do have this system. So that is one thing that you have to remember in psychiatry. समझ आई?
जी जी.
Okay.
Thank you.
It's a very simple thing. It's an enzyme system with lots of variations, subfamilies, superfamilies, genetically coded system to break down the drug into simple active and inactive compounds. The active compounds can cause side effects and the therapeutic effects as well. We should know their interactions. Any question other than this? जब आप लोग FCPS साइकियाट्रिस्ट बन जाएंगे और अपनी अपनी प्रैक्टिसेस में जाएंगे, उस वक्त आप लोगों के लिए ये चीज बहुत जरूरी है, क्योंकि चेक एंड बैलेंस खत्म हो जाएगा. ड्यूरिंग द रेजिडेंसी फेज यूजुअली द कॉम्बिनेशंस आर नॉट गिवन बाय द residents are careful about not to give the combinations, despite the fact that their supervisors are giving the combinations. But the rationale of combining one drug to another is very much scientific based. It should be साइंटिफिक बेस्ड. ये तुक्केबाजी नहीं है कि मैं ये दे दूं, ये दे दूं, ये दे दूं, कुछ तो बचेगा. But this is absolutely absurd. And this is what happens in most of the time when you see the prescriptions with 10 medications on a prescription. You always have to question yourself why 10 medications are given to the person. They are having drug interactions. They alter their efficacy and they induce more of the side effects. Yes, Benazir, go ahead.
जी सर, अस्सलाम वालेकुम. सबसे पहले तो सर रिकॉर्डिंग आप कंक्लूड कर दें, बिकॉज ऑफ दिस आई वांट टू डिस्कस वन